This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Normabrain syrup is used for managing myoclonus, which involves sudden muscle jerks. It contains piracetam, a nootropic that helps stabilize brain functions. Indications and uses. This syrup is indicated for the management of myoclonus of cortical origin, often occurring alongside other anti-myoclonic therapies. It addresses involuntary muscle movements caused by disturbances in the brain and nervous system, providing a path towards controlled physical responses. How it works. Normabrain syrup acts as a derivative of the neurotransmitter gamma-aminobutyric acid, GABA, enhancing membrane stability and fluidity in the brain, which leads to improved neurotransmission. Directions for use. Take Normabrain syrup exactly as prescribed by your physician. It's crucial to shake the bottle well before each use and measure your dose with the enclosed dosing cup. Your doctor will determine the appropriate dosage and duration of treatment based on your age, body weight, and specific health condition, so adhere closely to their instructions. Possible side effects. Common side effects may include restlessness, nervousness, and weight gain. If any side effects worsen, it's important to consult your healthcare provider. Precautions and warnings. Avoid using this syrup if you have severe kidney or liver impairment, are pregnant, or are breastfeeding unless advised by your doctor. Caution is also recommended for elderly patients and those with a history of cerebral hemorrhage or gastrointestinal ulcers. FAQs. 1. What is this syrup used for? It is used to manage myoclonus. 2. Can it be used in patients with kidney issues? Caution is required for those with renal insufficiency. 3. How does it work? It enhances neurotransmission via GABA. 4. Is it safe for pregnant women? Not recommended unless advised by a doctor. 5. What are the side effects? Common effects include restlessness and weight gain. Thank you for watching. If you have any questions or suggestions, please leave a comment below.